What were the medical consequences?
I was terrified.
It's the taxpayer-funded system that's supposed to get you through your final days.
I didn't feel protected. I didn't feel safe.
Hospice care to help those who are dying and their families.
They said, "You're in hospice." And I said, "What? What are you talking about? Do I look like I'm in hospice?" She goes, "No, no."
Kim with CBS News. Do you mind opening the door?
A CBS News investigation found it is ripe for fraud, especially in California.
Yep, you can't throw a rock without hitting a hospice.
Hundreds of red-flagged providers vanishing overnight.
Well, there's no hospice there.
Companies accused of overbilling.
How does that make you feel?
Real patients being denied care.
Really sad, because I talk to them every day. I'm sorry.
Costing hundreds of millions of taxpayer dollars.
You can't explain that. There's no explaining that.
What's being done about it?
Is my government doing anything to protect my taxpayer dollars?
I share it. I have the frustration.
And why it's costing so much more than money.
It makes me lose faith in the system that is built to protect us. Oh, you got a point. Woo, that was great. Let's do it again.
Lynn, you are old and in hospice, so I would be a little bit more proud about my accomplishments, but
69-year-old Dr. Lynn Ianni just ran me up and down the pickleball court. But 2 years ago, she was, according to Medicare records, dying in hospice care.
I was in treatment as physical therapy, simply because I had had a kind of an injury on the pickleball court. The administrator at the office was like, "They're not going to pay any of your claims." And I was shocked. They said, "You're in hospice." And I said, "What? What are you talking about? Are you kidding me? Do I look like I'm in hospice?" She goes, "No, no, I know you." And when
Ianni's Medicare number had been stolen and used by a company to fraudulently enroll her in hospice care, which she obviously didn't need. That meant Ianni had no coverage and no easy way of getting unenrolled from hospice.
obviously this was a major hassle. Lots of phone calls, lots of paperwork. What were the medical consequences?
I was terrified. I mean, you know, something can happen. That's why you have health insurance of any kind. And just to think you're literally without coverage because of some ridiculous, fraudulent thing.
My name is Adam Yamaguchi. I'm with CBS News.
A CBS News investigation found an industry ripe for fraud, especially in California. Companies accused of overbilling, real patients denied care, and it's costing hundreds of millions of taxpayer dollars. The hospice Ianni was fraudulently enrolled in is called Fortuna. When we called, no one answered.
The mailbox is full and cannot accept any messages at this time.
The state of California increased monitoring of the hospice industry 4 years ago, identifying the hallmarks of fraud. Fortuna has 2 of them, and it's hardly alone. CBS News analyzed every hospice licensed in LA County, more than 1,700, and checked for the same warning signs the state used, like multiple hospices packed into one building, or caregivers whose patients, supposedly at death's door, are discharged alive. 3 years after the state crackdown, which included a moratorium on new hospice licenses, our investigation found more than 40% of agencies still show at least 3 of these state-defined indicators of potential fraud.
So Victory Boulevard seems to be a hotbed of...
Yep, you can't throw a rock without hitting a hospice.
Sheila Clark, a hospice patient advocate, took us to what she described as the ground zero for hospice fraud, a 3-mile stretch of Los Angeles that's home to nearly 500 hospice company offices.
There's one hospice here that hits all 6 of California's red flags of possible fraud.
Well, there's
Says
no
it's a
hospice there.
Legal office.
Yeah.
With a ton of mail just
Yeah,
sitting
look
there.
at this.
This agency, VML, hit every fraud indicator in our analysis and billed Medicare roughly $49,000 per patient, about 3.5 times the national average.
They need their curative treatment. They need their they need to be taken care of. They need to know that they can get what they need when they need it, not hit a roadblock because somebody's scammed them.
The number you dialed is not in service.
Clark tells us when offices like these close abruptly, it's real patients in desperate need who pay the price.
How does that make you feel as somebody who deals with patients who need this?
Sad, really sad, because I talk to them every day. I'm sorry, I can't.
I wonder how they can go for a full year and still not have their license revoked. Is that a systemic failure?
We need to be responsive to the red flags and react to them, not just count them, but do something, take action. Our main lane is the accountability side, the criminal investigations, the civil investigations. That's after the damage is done, though, unfortunately.
State Attorney General Rob Bonta says his office has brought hospice fraud criminal cases against 109 defendants and about 24 civil cases.
What would you say to citizens who are throwing up their hands and saying, how long is this going to persist? Is my government doing anything to protect my taxpayer dollars?
Again, I share it. I have the frustration. So to the citizens that remain frustrated, I understand. I share your frustration. Please know that we have increased our efforts. We're working overtime on prevention and on accountability, and we will continue until hospice fraud in California is rooted out.
CBS News reached out to the almost 60 hospices that have 5 or more flags. Many numbers were disconnected or went straight to voicemail. Representatives at some others denied any fraud and said they run legitimate hospices with real patients. Back in Van Nuys, we tried the hospice right next door to VML. We knocked, then called during the posted business hours.
You can't leave a message because the person you call has a voicemail box that hasn't been set up yet.
Wow.
Bye.
We couldn't reach anyone, and we'd soon realize these operations may be connected, part of what advocates describe as a web of hospice agencies that come and go, but continue submitting a steady stream of bills to taxpayers, whether the patients are dying or, like Ayani, are still out playing pickleball.
This was what we refer to as ground zero. That building is considered ground zero because it just was so blatant.
Hospice patient advocate Sheila Clark has been raising alarm on this one building in LA for years. This building, our investigation found, is home to 89 registered hospice companies. It's called the Merabi Professional Medical Plaza, and it's the most extreme case of hospice clustering that we found.
And this particular building, I noticed, I'm like, dang, how can there be that many licensed and certified hospices in this tiny little building?
We went to the Van Nuys address to find out what's going on.
We're going to try to go in and see what we can find. Here's the directory. Hospice, Home Health Agency, hospice.
Can you come back?
Just looking at this directory, you can see dozens of hospice agencies coming up.
The state and federal records for hospice agencies tell you a lot. State auditors have identified warning signs when they're looking for fraud, like multiple hospice offices packed into one building, or caretakers whose patients who are supposedly at death's door are discharged alive. According to our analysis, 72 of the 89 registered hospices in Merabi Plaza have at least 3 of those potential warning signs.
This isn't possible. It made no sense because I know what a licensed and certified hospice looks like.
We weren't the first ones to come to this building. Federal inspection records show that regulators visited multiple suites in Merabi Plaza between 2021 and 2025, and they found nearly 400 violations. At one, a nurse wrote that a patient's family was satisfied with the care, but inspectors found no one from the hospice ever even visited that patient. At another, the patient's chart listed medications for malaria and diabetes, but the patient told inspectors he wasn't taking either one. And at that same company, a hospice social worker wrote about a family's grief when their loved one had passed, but there is no evidence the patient was actually dead. These hospices have been billing Medicare for reimbursement with your tax dollars for years. Why are we still seeing such, rampant signs of this? Why hasn't more been done?
We're committed to tackling the issue until we root it out and extinguish all fraud.
So who's working to fix this? Well, the state attorney general is the one responsible for investigating the industry here in California.
California is always going to have the biggest numbers. We're the biggest state. We're the 4th largest economy in the world. We have the most people of any state. And but this issue is unacceptable, and we need to keep tackling it and do more.
We're also following the money here. Medicare is federally administered. It's your federal tax dollars going to these hospices. So we sat down with Dr. Mehmet Oz, who heads the Centers for Medicare and Medicaid Services. Is this accelerating the enforcement, the shutting down of these hospices?
We have dramatically accelerated our ability to take out the bad guys by stopping their payments. And that's the big mindset shift. I want to make it clear, we're not going to pay you money just because you sent me a piece of paper with a bill on it. We're going to check to make sure that's legitimate and that document is evidence that you actually performed something that's helpful to the American people, or you're not getting money from us.
When we went back to Merabi Plaza, we found the building's owner, Kambiz Merabi.
I have vacancies. Tenant would come in as long as they're legit. They have valid things that we need. I rent. I'm not a police or keeper of what they do, how they do business.
So from your perspective, they're licensed. You know, that's obviously the first sort of barometer of, you know, measuring whether
Correct.
it's a legit business or not.
Absolutely. And look, maybe state and the federal government, it's becoming restrict on many businesses, and I'm all for it, because at the end of the day, you and I are paying for all those things that are not right.
Merabi wouldn't let us walk the halls on our own to talk with hospice employees, but told us this about any possible fraud.
If you learn of hospices in your building that are accused of fraud,
I would immediately
you would get rid of them.
terminate.
Okay.
Yes.
But that hasn't happened yet.
No, no one has ever come to me, tell me that, okay, this or that is doing fraud.
The state of California says that if a doctor is involved with any more than like even just a few hospices, it is a sign of potential fraud.
A CBS News investigation into hospices found an industry ripe for fraud, especially in California, where agencies were paid millions in taxpayer dollars for services never rendered, care that's supposed to help people through the end of their lives. At the heart of the industry are doctors who are trusted to sign off on care. But in records for the active physicians caring for terminal patients, one stands out. A man whose name appeared on claims from 126 hospices and had 60% more in Medicare reimbursements than the next closest doctor in 2024, the last full year of available data.
Yeah, my name is Adam Yamaguchi. I'm a correspondent with CBS News, and we're doing a story about hospice.
Dr. Rajiv Buva.
We're just trying to understand how often he's here.
We wanted to find Dr. Buva to ask how he managed to work for so many different providers. So we followed a trail of hospice offices linked to him in Medicare claims across the LA basin.
My only comment is not every hospice is like that. There's people who really need the help, and we do provide the help.
Our information tells us that he billed Medicare upwards of $5 million as of the end of September of 2025.
So there's some sort of disconnect between what the records show and what they are telling us.
That disconnect only grew as we followed the federal data trail, which links Buva's name to $71 million in federal Medicare claims in 2024. We followed the money to another hospice where Buva's name was on bills for 66 patients in 1 month.
He was like, that's impossible. We couldn't possibly have that many patients at any given time. And he also told us that Dr. Buva no longer works there.
On average in California, a hospice doctor cares for about 140 patients in a year. In 2024, claims with Buva's name were submitted for nearly 2,800 terminally ill patients. Fewer than 2% of them died, even though most people seek hospice because they are dying. State auditors call that kind of low death rate a sign of possible fraud.
There's no reason to think that that's legitimate.
Dr. Christina Newport has been in the hospice field for 18 years. There are a range of reasons why one physician might be identified in connection with the care of so many patients. One possibility, the doctor's identity was stolen and used to fraudulently bill the government.
Why would it be difficult for a doctor to work at dozens of hospices at any given time?
If someone is really effectively evaluating the plan of care for every patient that they admit to the hospice, which is their job and their responsibility, they, would have a superhuman schedule to do that in a meaningful way.
We don't know exactly why Dr. Buva's name came up so much. The data trail led us to another hospice nearby.
We understand that Dr. Rajiv Buva is the medical director here. We're just trying to get some information about it.
He's not.
He's not? No. Was he at some point?
Yes, he was.
But you're telling me he no longer is associated with you guys? No. Was he at some point?
CBS News found Buva's name tied to several hospices that lost their Medicare certification for what regulators called an abusive billing, a pattern of submitting improper claims. We reached out to him on the phone and email, but couldn't connect with him. With no sign of him at these offices, we headed to Dr. Buva's home address. I am parked right outside his house. Hopefully he will answer the door and answer some of my questions, and if not, I came prepared with a letter here. Dr. Buva came out, surprisingly spoke to me for about 20 or so minutes. He knew exactly who I was. He was very familiar with our reporting and immediately said, I don't know what else I can tell you. He said that being affiliated with dozens of hospices is not illegal, right? And I said, you're correct. There's nothing in the law that prevents someone from being affiliated with many. But again, it raises flags, and that's what I have questions about. Buva said he wanted to see our information. Until then, he wouldn't talk any further.
I'm back at Dr. Buva's house, right here.
We returned with our data.
Hi, Dr. Buva. This is Adam Yamaguchi again with CBS News. We were able to hear you through the door. Just want to give you every opportunity to speak with us before we publish. I've got a list here. Give him every opportunity. Rang 3 times, knocked once, talked through the wall, or the door rather. Came with what he asked for. He's made his decision not to talk.